Small Business Forum agenda that we're going to have today. So I'm going to kick it off by thanking you for participating in this Small Business Forum covering the topic of COVID. And we are excited to host this event along with our sponsors, Port Arthur LNG, Anya and Kelly are fantastic members of our chamber and our community, and we enjoy partnering with Port Arthur LNG. They do great things for this community on a large scale basis, and they are truly committed to our community. So we're going to start the program now by introducing our first speaker, who is Mr. Joe Tant. Joe is our financial manager of our chamber and executive director of our education foundation. He has, I guess he's also the executive director of our COVID project. We received a note from the governor's office probably about 5 weeks ago, wanting to give us COVID tests to give out to small businesses, et cetera. And so we were delighted to get involved with that. They only allowed their certified, accredited Chamber of Commerce to handle this, distribution. And we are also partnering with the emergency management local folks and those folks at the state level as well. So I'm gonna turn the program over to Joe Tant at this time, and take it away, Joe.
Thank you, Pat. So one of the important items that I wanted to make sure that we covered today is the Binax testing that we've received from the Abbott Corporation here at the Greater Port Arthur Chamber of Commerce. Your chamber is a 5-star accredited chamber. So there's only a handful of those in the state of Texas. So when they reached out to us and asked us if we could help small business, Pat, Paige, and I jumped on the opportunity to be able to help. So a couple of different things I wanted to make sure that our small business was aware of. Number one, you can be in business in the state of Texas, and we can provide you with these free COVID tests. There are 2 real reasons to use these tests. The first one is obviously if you have an employee that has tested positive and they've been out of work for 2 weeks, a lot of my Workforce Solution folks know hourly folks that are out of work for 2 weeks do not always have the funds to spend $150 to have a test to go back to work. This way, your company and that employee does not have to absorb that cost. The next item, just as an example, let's say Miss Robin McCutcheons and I go to lunch and we get a call in a couple of days saying, hey, your waiter was exposed to COVID. You might have been exposed. Robin and I can take that test, and within about 15 minutes, we're going to know whether or not we are positive or negative. So that is a very key point. Now, we have got a fantastic group of folks here at your chamber. Everyone is certified in this process from the Texas Division of Emergency Management. Miss Mariah Perez is helping head this up with me, along with Miss Raven, Miss Juliana, and Callie, to make sure that all of our members have the access to this test. Mariah, correct me if I'm wrong, I think we are currently sitting on about 55 additional tests. Is that correct?
49.
49, okay, good. That's a good thing to have. But we've also been given the opportunity to get more. When Ms. Perez and I reach the 70% level of tests that we've been given out, we're able to get those overnighted to us and have them the next day. So the governor's office has been very generous with that, and I feel like that's worked out really, really well for our chambers. The opportunity to get these tests is very easy, and that's one of the reasons that I asked Ms. Avery if we could have this forum today. A lot of our members are concerned. They're not experts like Miss Judith Smith. They don't have 82 degrees hanging on their wall like she does. And so we want to make sure that the general public knows it's a very simple process. It's a video that you are going to be watching 30 to 35 minutes. At the end of that, there's about a 15-question test that you'll go through. I scored 83. Miss Mariah and everybody else got 100. So I'm just underachieving at the moment. But it worked out really, really well. We were able to get those tests provided to our members that have already taken advantage within less than 24 hours. The Texas Division of Emergency Management will give you a certificate saying you've met all the requirements. That goes to Mariah and I, and you come pick up your test. There are 40 test kits in each box. If you have over 40 employees, when you get down to 70%, you come back by the chamber, and we'll give you another box to get you up and running and get that started. So it's worked out very, very well. I do want to say a special thank you to Ms. Robin McCutcheon, who is the executive director of Samaritan Counseling Services. She's agreed to kind of step in and maybe provide some insight from one of the true small businesses that we have, to be able to give us a little insight, Robin, maybe on what you've experienced, and I'll turn it over to you.
So it actually was very timely in the fact that at the time that the chamber offered this service, we had 3 staff members who were in quarantine. One who was actually sick, and who had tested positive from another facility, and 2 were in quarantine because they lived with someone who had tested positive. So very timely for the chamber, because we were able to use our first 3 tests for those employees to come back to the office. So they didn't have to go seek a service. They didn't have to pay out of pocket. Even just finding a location that can provide that in a timely fashion had been a difficult thing to do. So those 3 employees came back very quickly back to the office. We have since had an employee who had a family member in an assisted living who had not been able to visit their family, but the facility opened up only if you tested negative. So we allowed them to use one of our 40 so that they could go visit a family member who they had not seen since March of last year, which brought great joy, right, to all of us for them to be able to do that. And then ironically, we had a staff member who, right now, we have lots in our community, even myself included. Our allergies have started coming around, and a little sinus congestion. And we've had some staff members very uncertain. Is this the beginning of COVID? But a staff member yesterday started running fever and things like that, came in the office, tested, and was reassured she's negative, but now knows that it's probably a sinus infection. But I think that that's going to be a part of moving forward in this kind of first spring during this time. So we have saved lots of man hours just in this short 4 weeks that we've been able to work with 7 of our employees already, that they were not, they didn't have to go seek this somewhere else. And we've been able to do that just right here. I do have to say, for those who were fearful of having to use the swab, that was one area that I thought, oh my goodness, am I going to be able to do that? In the video, it very clearly shows that the employee does their own. And so don't be fearful of that part. They swab themselves. And so you don't have to be a part of that. And it has just been a nice addition to a service that we can offer, that it comes to a space that they don't have to go seek it out more than anything.
So Robin, did you find it easy to use everything?
We did. And I have to be honest, the first time we did a test run, something didn't work the way it should have. We didn't put enough drops, I believe, on the card. And we called the information line Also contacted the chamber just to let them know that, hey, this didn't work the way we thought it should. Within 24 hours, the information line had sent us a new test. I mean, we had it before we came back to work the next day. In the information line, they answered our questions immediately. So much easier than some of the insurance companies we deal with.
That's a great question, or a great point too, Robin. Thank you for making that. And I know that Ms. Judith is going to get into this, but a lot of folks have talked about, well, is it COVID? Is it my allergies flaring up? A few weeks ago, it was below freezing, and today it looks sunshiny and 70. And yesterday, I thought it was going to rain. It's kind of been a thing. So you're right. That in itself will give your business a little peace of mind to be able to work. Look, if you've got allergies, come on in the office and let's talk. If you've got COVID, love you, go home. So that really does put a lot of our small business owners at ease, knowing that you're clear. And that's a great point for that. I do want to say a special thank you to Port Arthur LNG, because Anya and Kelly have done a fantastic job in this area, being able to support us with some time so we can make this program work. When you've got 600-700 members, getting the information out is always a fun time, to say the least. So with that,
before you go on,
yeah,
Joe, I just want to say a couple of things. Number one, folks, these are the kind of things that government does to step up to the plate. And so I want to take my hats off to our government, our state government, for thinking about small business and putting resources in their hands so that they can continue to run their businesses and keep their employees employed. So we have lots of kits here. They sent us what, over 2,000 kits. Don't be hesitant to let us know if you need more kits. I think the dates on our kits expire sometime, maybe April, May. I'm not quite sure about that. Joe can give us that information, but
July.
you use as many of these kits as you need to, because we have plenty. We're hoping that after this small business forum, that other companies will reach out, small businesses will reach out and get more kits from us, but we've got plenty here.
Yeah, we confirmed with Miss Mariah that our tests do not expire till July. Is that correct, Miss Mariah? So yeah, we're very excited for that for sure. Pat, anything else you want to add to that before I introduce our all-star?
I don't think so, unless Anya and Kelly have joined us and want to say a few words. I think we can move on to our wonderful head of our health department here in Port Arthur, who's just done an amazing job with everything on her plate. So I'll turn it back over to you, Joe, if Anya and Kelly are not on board yet. We had a breakfast this morning, and you can introduce Judith Smith.
Yeah, I know they're traveling. And Judith, I absolutely do love you. I just want to let you know that. But let me introduce our all-star. Ms. Judith Ann Smith is the Director of Health Services for the entire city of Port Arthur. She graduated from Lamar University, go Cardinals, in 1979 with a Bachelor of Science in Nursing, graduated out of the Lourdes Outreach School of Ministry with a doctorate in theology in 2016. She has been with the City of Port Arthur Health Department since 1983. How are you 18 and you've been since 83? I don't know. Anyway, she's staff nurse working in the immunization and STD clinics. In 1993, she became the nurse supervisor for the TB clinic under Texas Department of Health and worked this program for 12 years. Judith became the assistant health director in 2005, and later in 2013 was appointed director of health services. Judith oversees 11 divisions within the health department and provides public health services to South Jefferson County. Judith serves on the board of the Julia Rogers Gift of Life and the YMCA. She is a member of the Southeast Texas Black Nurses Association and the National Black Nurses Association. She is also a Rotarian. Judith is married to Dallas Joseph Smith Jr. for the last 38 years and is the mother of 2 adult children and 1 fantastic granddaughter. Thank you, Miss Judith, for joining us today. I appreciate you, and I am going to be quiet now and let you do all the cool talking.
Thank you. Thank you so much.
Joliana, can you remove the agenda and put Judith on there on the screen?
Okay, thank you so very much. And I really appreciate just the honor of being able to share some of the updates with you all. I actually have notes here because I really just didn't want to forget anything that I feel like is really very important, because we started this process last year, and it doesn't seem like it's been a year, but we have actually been going at this now for a whole year. So I just kind of actually divided it into where we were, where we are now, and where do we want to go. So where were we? If you can just think about it. Let me just tell you that last year, early January of 2020, we received, because the health department generally receives all of the reportables for our area, but we were receiving a lot of calls from our local emergency rooms, with people going in with flu-like symptoms. Even our primary healthcare clinic at the health department, we're actually seeing many people coming in with high fever, body aches, fatigue. And it was so strange to us that these individuals were actually testing negative for flu. And so many physicians actually just began treating with Tamiflu because these were people with flu-like symptoms, and perhaps maybe just the flu screens and the strep screens being negative, we felt like maybe the Tamiflu would work. All of these symptoms were just so strange to us that so many people were sick, but all of them were negative for flu. So of course, we would never know if some of the people back then in January, way before we kind of really started seeing COVID, we don't know if these people actually had COVID before we really knew about it. But the health department, let me just tell you, we've began planning for pandemics for many, many years. As Joe stated, I started here in 1983, and I'm at the age of 26, almost right out of nursing school. And we started talking about pandemics long ago. I remember in 2005, right after Hurricane Rita, attending a conference in Austin, and the 2 words that they kept saying, the things that they kept letting us know was, it's not if it's going to happen, it's when it's going to happen. And so, we went years and years just thinking about pandemics. Plans were put in place for a pandemic. What would happen? What will public health look like once a pandemic hit? And so this pandemic did not take public health by surprise. Not totally. I think the magnitude of it, perhaps, but really it did not. Back in 2009 in early April, when we started hearing about H1N1, we started looking at that, thinking about it. Pandemic plans were already in place. Early April, the health department was actually helping to test people back then. I don't know if a lot of people remember, because it was a lot in the news, but it was not a lot locally, and that was good. But by November of that year, there was a vaccine readily available for H1N1. In 2012, we heard about Ebola. Well, For us, it was truly a blessing. We did not receive a lot, and we only had one case that we knew about that was close to us, but none in South Jefferson County. So since January of 2020, public health officials locally and all over the United States began to activate pandemic plans, put them in place. Daily conference calls, daily conference calls with not only our regional Texas Department of State Health Services, but even in Austin, just hearing about what we needed to do, what it would look like, how testing was going to go forward. And so as COVID cases began to increase in Texas, Governor Abbott issued a disaster proclamation, and that was in March. Linn County at this time was planning to come together to devise methods for mass testing site. And this actually began at the airport. And our health department staff, our nurses, we brought all of our nurses out to the airport and began doing the COVID testing. We saw many people on a daily basis, and I think that we stayed out there maybe close to 2 months. That was March the 24th of 2020. And so late March, I want to think maybe the 26th, I reported the first COVID case for Port Arthur. And so actually before then, we had established a COVID team in the health department because we knew that once we reported one case, we were going to be reporting many others. And so the COVID team actually was set up to help with case investigation and contact tracing. On March 30th, Governor Abbott issued several self-quarantine edicts for travelers returning from certain locations within the United States, because we knew that certain areas where people were traveling from were hotspots. And so when we actually were investigating COVID cases, we started asking people, have you traveled from this area or have you traveled from that area? But after a while, it didn't matter whether a person had traveled or not. It really didn't matter because people were actually becoming positive who had not traveled at all. On March 31st, 2020, Governor Abbott issued an executive order implementing essential services and activities protocols for the entire state of Texas. The protocols renewed the governor's directive for the public to avoid eating or drinking inside bars, restaurants, and food courts. Drive-ups and pickups and delivery was encouraged. And this order prohibited going to gyms or massage establishments, tattoo and piercing studios, and cosmetology salons. In April, schools were closed to the classroom attendance. But in the midst of the various orders, we were still getting cases. We were still getting many cases. And messages and information was going out to try to tell the public and help the public, because we felt like based on all that CDC was reporting, social distancing, wearing a mask, which was not a mandate at that time, washing your hands or using the hand sanitizers as necessary, staying home if you're sick, and unfortunately we get so many calls stating that I'm not feeling well, but I have to go to work because I have no sick time. And we knew that the symptoms that people were giving us were symptoms that possibly could have been COVID related. And the only thing that we could tell them was that you must get tested. You must stay home if you're sick. But we know that everybody did not stay home. Everybody really could not stay home. And so not only were the testing being performed at the airport where we were stationed, but a lot of other labs and even some private physicians started doing the testing. At that time, people were actually looking for where they could get a test, but people were wanting to get a test and having it where they could get those results really quickly. And so, this seems like a year later, but such an awesome thing to know that businesses can now test people. That is really amazing. And we're really happy about that. But citizens were encouraged to test regardless of symptoms. When we first started at the airport, the criteria that a person had to have, the symptoms a person had to have before even coming to the airport or even being given an appointment to come and get tested was fever, shortness of breath, dry cough. April drank asymptomatic were tested because by then we knew that asymptomatic people could actually also be carriers. Initially, CDC stated, because just like with most communicable diseases, if you have the symptoms, it was travel, especially with the coughing that, coughing or sneezing or talking, the droplets would, go forth and infect other people. But as time went on, we knew that people were asymptomatic because people were we were reporting people, our case investigators were calling them, people were having no symptoms at all. Some of them were maybe complaining of loss of taste, loss of smell, but the majority of them, I'm not gonna say the majority of the young people had no symptoms at all. So the governor had phases to reopening certain businesses after a while, and this became a process, but it was not until July the 2nd of 2020 that Governor Abbott issued an executive order requiring all Texans to wear a face covering over the nose and mouth when they were in public spaces in counties with 20 or more positive cases. But by the end of July, the health department, because our health department reports for Port Arthur, Nederland, Port Neches, and Groves. By the end of July, and I want to think this was maybe, I looked it up, August the 15th, somewhere in that time period, we had actually reported over 1,300 COVID positive individuals for the areas that I report for. And 15 people had already died. So 2 words that public health officials dread is community spread. Once community spread starts, it really became out of control. I wouldn't ever sugarcoat this and say that the health department ever had this under control, because we did not. And by that time, we could not, because community spread had already taken place. So grocery stores, perhaps drive-throughs, physician offices, churches, daycares, you name it, nobody was immune, nobody. Even people that told us that they practiced social distancing, they never left home, they had the groceries delivered to them. Some people still developed COVID, unfortunately, because it only took one person visiting them or being with a family member without a mask on only one time. So contact tracing for us was very, very difficult. A little bit better now, but it was very difficult. And especially through last spring and summer, because despite us, telling people, social distance, please don't have big gatherings. We had graduation parties, we had Memorial Day, we had Mother's Day events, we had July 4th events, and people still gathered, because it was so hard, and people, actually began having situations, being quarantined. We're human. We're social. We like to get out. We like to visit. It was difficult. So in spite of us saying that, we really understood, but people were still dying. People were still getting sick from COVID. And so we were trying to, get that message out. We even did a young people's forum, maybe the end of July, because this is what we started seeing. Many between the ages of 20 and 35. For one period, I reported so many in this age group. Very few of them were sick. So we wanted to get that message, and we gathered some of our young employees, and we had them to invite other people in their peer groups to try to tell them how important it was for them to try to follow the guidelines and encourage others about social, the distancing and wearing the mask when they get together, because they were gathering together without the mask on, and they had to think about the elderly grandmother or the parent with the underlying health conditions. And so that was the message we wanted to send them. It's just not about you right now. You have to think about the others. So then we had to think about, was there a safe way to open schools? The superintendents were calling. And honestly, we could only tell them, this is what CDC says. I don't really know how we could open our schools safely, but many of the schools opened and did an excellent job. Many of them had the virtual learning. Many did the in-class with the classrooms, with the mask requiring. And even though there were children that we reported with COVID, many of the staff, the principals, the superintendents, they did an amazing job because it was very contained. We knew who we had to quarantine, and it was not, when schools shut down, they shut down for cleaning. It wasn't because there was an epidemic in the school, and that was amazing. It was only because superintendents felt like, let's close this school just for a 3-day cleaning. And so that was really, really good. So let me just tell you, where are we today? So as of February 2021, the health department has reported 3,277 positive cases for Port Arthur and 70 deaths. 1,867 positive cases for Nederland and 23 deaths. 1,207 cases for Groves and 16 deaths. 1,159 cases for Port Neches and 11 deaths. And I do these daily on the City of Port Arthur website. Each day, our epidemiologist do get the reports. She gives them to me. I make a daily statement, and it is placed on the City of Port Arthur's website. So many of the people that were tested positive for COVID, many of them recovered, but unfortunately, some did not. And of those deaths that we reported, I want to say that 95% of them did have underlying health conditions, but there were 5% perhaps that did not. And we have no idea. And that's one of the things that we would try to let people know, that yes, it may be more of a problem and a concern for people with underlying health conditions, but we don't know if a person gets COVID, we don't know how that virus will affect them. We really don't know. So from the beginning, let's see, hold on one second. From the beginning, health officials would have to patiently wait for the time when there would be a vaccine available. And so, we started hearing about vaccines well in early 2020 at the beginning of this, because we knew that at some point in time there would be one. And so even as we began and we helped out with the testing, we knew that when the vaccines were available, we were going to be ready to have boots on the ground to administer those vaccines. So it was wonderful for us to hear December the 11th, 2020, that the United States Food and Drug Administration issued the first emergency use authorization for a vaccine for the prevention of coronavirus, and that was the Pfizer vaccine. And then 7 days later, on December 18th, one was issued for the Moderna. And this was really good news. I want to think early January, it was sometime at the beginning of January, we did a virtual town hall to just inform the public about the vaccine. Our health authority, Dr. Oscar Enrique, came on board with us, and actually did a presentation to explain the messenger RNA protein that these vaccines, the Moderna and the Pfizer vaccine, how it was made. Because many people, we just did surveys on the community. Many people stated when the vaccine was available, they would not take it. Many people. Many people were hesitant, and many people are still hesitant today. So that was one of the reasons we did the virtual town hall, so that we could give the information just based on what we know, based on what we, even from sitting on the trainings with Moderna, sitting on the trainings with Pfizer, just from the information that we knew. We wanted to share that because many people were getting their facts from Facebook and social media and just from friends and family. And so we just wanted to give them what we knew so that they could make a decision based on the facts, whether or not this vaccine would be good for them. And so that's what we did. Many people, I think we had about 90 people that chimed in to that town hall. My big mistake, I forgot to record it because we did have a lot of people afterwards that asked us to please share it because they couldn't attend. But people call all the time, and I'm very happy to share what I know about the vaccine because so many people are hesitant even when they come here. Many people are still very hesitant about taking the vaccine. And so we do know that Johnson & Johnson also has received their emergency usage authorization, and this was February the 27th. It is a single dose vaccine. We have ordered it. I don't know whether we will receive it or not. I hope that we do because we've gotten a lot of calls and requests for that vaccine because some people just don't want to take the two. So the health department received our first shipment of Moderna on January the 7th. And we became a part of the hub with Jefferson County, so that now we are receiving 500 doses of vaccines weekly. That is one of the reasons we moved from our health department to the Civic Center to be able to provide more vaccines to more individuals that come in. Initially, we started having people to call us at the end of, early January, once we came back after the holidays, telling us to put their names on a list. We had nothing but a list. And so mid-January, our IT department set up an online registration for us. And then once the county became a hub, they set up the vaccine.beaumonttexas.gov website. And so we actually had a little problem making appointments for individuals. And so about 2.5 weeks ago, we made our hub more accessible to individuals by allowing people who had already registered on our website, at the vaccine.beaumonttexas.gov website. And if they've chosen the Port Arthur location, they can just show up with their registration number. We made it so much easier for people who are 65 and older because we realized that people were calling us and telling us, I cannot register. I don't have computer access. I don't have a computer. And if I did, I wouldn't know how to do it. And our staff was actually registering people. And so we realized that I didn't have enough staff to do that. So what we did, we took that part out completely. So if people are 65 and older, they don't need a registration number. They don't need to register. They just need to show up and they will be serviced. So where we want to go from here, let me just tell you, I don't know how long we will be at the Civic Center. I think that we will be here at least 2 more months. Our goal is to vaccinate as many people as possible, we have not promoted the vaccines to 18 and the younger adults yet. However, if they have registered and they show up, they're not turned away. Because let me tell you, some of these young need them for that when they get here. And because that would take a little bit more time if they have registered on the website. And now, because we are giving the Moderna vaccine, which is licensed for 18 and older, if they show up, they are serviced. And so with that stated, if you have any questions, I'll be happy to answer them.
Judith, I've been listening to the national news, and they've been saying lately that they're starting to study these people that have no symptoms that all of a sudden just drop dead. And it seems to have something to do with a COVID in the brain. Have you heard about this phenomena? And if so, can you share with us what you know about it?
So one of the things that we actually heard and read about, this may have been 6 months ago or more, was some of the younger adults, and this was in other states, that had happened to, and they found out that it was like a stroke from the COVID. They developed COVID and immediately it went to the brain and developed and caused a stroke. And so, I mean, that is so unfortunate. We don't know why, we don't know how that works, but that can very well happen. We've not seen any locally, but that is always a concern. And so, that's one of the things ma'am, I'm sorry.
Go ahead, I'm sorry. I have another follow-up question after
That's one of the things that we've shared, even when speaking to young adults who feel like, well, it's really nothing to this COVID. If I get it, I may just have a runny nose, or I may have just lose my taste of smell, or my sense of smell or my taste, and that's all. We tell them you just really don't know. You really don't know. We don't know what it is that makes some people sick, what it is that makes some people that the virus will go to the brain, cause stroke. We don't know. It's just so much about this novel virus that still it'll be years before scientists know everything.
The other question, thank you for your answer on that. The other question I have now, as I listen to the news reports, there's this thing called long haulers COVID, where people are not recovering after 14 days, but are having brain fog and symptoms 6 months after COVID. Can you talk about that a little bit?
So that's another thing too. And let me just tell you, this is what we hear a lot with people who are hesitant with the vaccine. We don't know the long-term effects of the vaccine. Okay, yes, that's true. But with the virus, we are seeing people, and I mean, it's not a lot, but we are seeing and hearing of people who have who may have been diagnosed last year in June, who are still having problems with brain fog, as they are now terming it, and pulmonary problems, lung problems, issues with the heart that was not diagnosed before they had COVID. So, there's still just so much about the virus that we're not sure.
Did we lose her? Oh my goodness.
I think we have lost Miss Judith. She was, we were getting some low bandwidth. I think she was at the Civic Center, and that may be part of that problem. Jillian, if she rejoins, we'll get her right back in, because I think we have a couple of questions for her. And if she's not back in a couple of minutes, we'll do something.
The other, Fernando, it sounds like we're on the radio of the Hispanic radio station. Do you have any callers that have questions that we can pass on to her?
We have Judith back on the line.
There she is.
Not yet, but as soon as you do, I'll be glad to put them out there. But the thing is, we're putting it out there for everybody because you're doing a fantastic job, and I salute you and congratulate you all. Thank you.
Thank you, Fernando. All right, Judith, can you
I
hear us?
I think my computer just went out for some strange reason, so I'm on my phone. Can you hear me?
Yes,
Okay, I'm sorry. I'm so sorry.
that's okay.
Ms. Judith, we have a couple of questions. If you have a minute to answer those, I think
Yes.
Raven has got some questions on Facebook or Twitter, but they're coming in.
Okay.
Hello, Miss Judith. I'm Raven from the chamber. Can you hear me?
I can. Yes, ma'am.
I had one question for you. Do you think, since you're, administering all the vaccines to everyone, trying to get it out, do you feel that COVID will slow down or potentially end soon?
Well, one of the things, Raven, even before we started administering the vaccine, well, let me just say this, no, this has been since we've started administering the vaccines. We have seen a decrease in the number of cases that we're reporting daily. I do believe that, and I don't know if that is just because less people are being tested, because I don't feel like we have administered enough vaccines yet to actually see the big decrease that we want to see. I'm hoping, though, if we can get a good portion of the community vaccinated, that absolutely we will see a difference. That we will see a difference. We will definitely see. I mean, I don't know. And here again, there are some people that still, even after the 2 vaccinations with Moderna or Pfizer, or with the 1 vaccination after Johnson & Johnson, there's still going to be some people who develop COVID.
Right.
There will be. But the goal is to prevent hospitalizations, prevent them from becoming severely ill, to prevent death. So we're hoping that the majority of the people do develop a very good immunity after the vaccines are given. But for those that still may get COVID, that hopefully and prayerfully that it will not be, cause severe illness or death.
Well, I'm sure you've heard about all of the mask situation. As far as that, do you feel like the numbers will go back up, being that a lot of people, will not be wearing masks, or, maybe not even following social distancing protocols?
So, yeah, this is the thing too. I get asked that question all the time. I really do. And trust me, soon as that mandate, the discussion about the mask, my phone started blowing up. And I can only tell you that if masks are not worn, and you have no idea the status of the individual that you are around, because here's the thing with me, I can tell you, those who I will be around without a mask will have to have had their vaccinations.
Right.
And so I do believe, unfortunately, because everybody still has not decided on the vaccination, everybody will not take it. So I do believe, unfortunately, that people will start gathering together again. They will start doing, kind of falling back into some of those, the things that we did before. And unfortunately, some of our numbers may go up. Now, I hope that does not happen. I really hope that does not happen, but I feel that it very well could. Yeah.
Okay,
Miss,
go ahead, Fernando.
I just want to tell Miss Smith that, I've known her since '83 when she was with the city. We've been working together. But,
Yeah.
I want to thank you for always giving Otto Hispanic Media the information to put out there in Spanish for the community, and, count on us to continue. and you're doing a great job. And I just want to say thank you.
Thank you. Appreciate you.
So, Judith, how many people have you vaccinated so far in our, and tell us where they're all coming from?
Okay, well, first of all, I know that it's been close to, and let me just tell you, I have not really had a chance to keep up with the numbers, but I get the numbers daily. He tells me how many we're doing, but I just don't know the total. I know that it's well over 8,000, 8 or 9,000. I can't tell you exactly where the people are coming from, and that's because once our hub opened, people had registered on our website. They do not have to live in Port Arthur or Port Neches or Neyland or Groves. So, and because that's the areas that I report for, but people are coming from Houston, people are coming from Orange, Bridge City, because people are stating that it's just really hard for them to get vaccinations where they are now. The majority of the people I do believe are from our area, but I just can't say that they are. And because, when we receive these vaccinations, we are generally told that we cannot deny them to anyone that comes for them.
Judith, thank you so much. We are so lucky in Port Arthur to have you. You communicate so well. It's been great seeing you all over TV, all over radio, telling our community, keeping us informed about this horrible pandemic. And so we thank you so much. I am going to wrap this up now because we're running a little bit over time, but we again want to acknowledge our sponsor, Port Arthur LNG, and we have Anya on the call with us, and want to give her the opportunity to wrap this up if she'd like to share some comments at this time.
Pat, she may be having trouble with her audio too. She's kind of going in and out. So
Okay.
you may want to go ahead and take care of it.
All right, well, with that being said, we may follow up, Judith, with questions that come in.
Okay.
Everyone, please let people know that this is on our website. Robin, thank you so much for your comments that will help people feel much more comfortable given this test. And please spread the word, everyone, that your state government has provided these kits to you, and take advantage of making sure that your people stay healthy and safe. Thank you.
Pat, this is Pam. We are going to link it onto our Facebook page also for employers.
Thank you so much, Pam. We appreciate that.
You're welcome.
And with that said, thank you all and have a great day. Look for our next small business forum. Thank you.
Thank you.
Thank you.
Bye-bye.